I'm Dr. Rashmi Halker Singh. I'm the Deputy Editor of Headache. It's my pleasure today to be joined by Dr. Simone Braca, who is the first author of a recent publication entitled Effectiveness and Tolerability of Liraglutide as Add-on Treatment in Patients with Obesity and High Frequency or Chronic Migraine, a prospective pilot study. Welcome, Dr. Braca. I'm so happy to be speaking with you about this paper. It's generated so much interest. I'm so happy to have this conversation.
It's a pleasure for me to be here today with you. So yeah, it's an honor actually. Yeah.
So, the moment this paper went online, it's generated a lot of interest, so many downloads, so much conversation. But and I think we've already seen the impact of it, but I'm curious, what caused you and your colleagues to even study this to begin with?
Well, I would say that my research group, the research group in Naples, Federico II, led by Professor Roberto De Simone, over the last 15, I would say, years, has been exploring the possibility that an arrangement in intracranial pressure control, although milder, although intermittent, could be nonetheless one of the pathophysiological mechanisms underlying migraine.
Okay.
And therefore, given that these drugs, GLP-1 agonists such as liraglutide, which is the drug that we used in our study, are greatly able to reduce intracranial pressure, we thought, well, maybe if that's actually one of the pathophysiological mechanisms, then the drug should work.
I think that's very interesting, very fascinating because we see patients that fit this phenotype in clinical practice. So tell me about your study. What did you do? What did you find?
Well, we enrolled patients with obesity because the drug is currently labeled, as you know, for obesity and diabetes, but obese patients with migraine, of course. And we enrolled 31 of them, and we administered liraglutide 1.2 milligrams daily and followed them for 3 months. And the results are pretty straightforward in the sense that monthly headache days reduced of approximately 10 days, which is a lot. And what's even perhaps more interesting is that conversely, BMI did not we did not see a similar reduction in BMI, and therefore weight loss did not influence the effectiveness of the drug. That is, the effectiveness of the drug is not to be attributed to weight loss.
I think that's so interesting. So a couple of clarifying points. The study went on for 12 weeks, so they were followed for 12 weeks, and in that 12-week time frame, these individuals saw about a 50% reduction in their headache frequency, but no significant changes in their weight, correct?
Yes.
Yeah. So I've had conversations with colleagues, and their comment to me when I've just shared about the study without telling them any details was, oh, obviously they saw a headache improvement because their weight improved. And I had to go back and say, well, actually, that's not what we saw or the author saw because the
Yeah.
weight did not change. It was really a direct impact on headache frequency independent of any changes on weight. So, given that, what do you think this means from a migraine perspective? Do these medications, are we suggesting that might have an independent effect on headache pathophysiology?
Well, of course, the speculation, because we have to keep in mind that this is a pilot open label study, so it needs to be confirmed by subsequent larger multi-center
Absolutely.
with a placebo comparator arm study. But that being said, the speculation, and again, which was, originally thought of my Professor Roberto De Simone, at least 15 years ago, is that again, derangement intracranial pressure control could be one of the pathophysiological mechanisms of migraine. And if that's the case, it means that quite importantly, it is a targetable one, a pharmacologically targetable one. And these drugs, they do reduce intracranial pressure, and they do it much, much more so than the drugs commonly used to do so, such as acetazolamide or topiramate. What we know is that they are much more potent in this regard. And therefore, what we think is that in our study, they exerted their beneficial effect by reducing intracranial pressure.
So,
Again, a speculation, but that's what we think.
so are there plans to do this randomized controlled study to better clarify and better understand this possible explanation?
Yeah. That's what's coming next is that we want to plan a randomized controlled studies, ideally in a multi-center fashion, and to confirm this data, but not only to confirm the data, but also to validate the mechanisms underlying it. So we will want also to measure intracranial pressure to see if that's actually the mechanism.
So,
What we think
yeah.
so, but we have to prove it. Yeah.
Yeah, absolutely. So in the meanwhile, though, for people like me who are clinicians and take care of patients like the ones that you described in your pilot study, what can we take from this? Next time we see a patient who might fit this demographic, and which patient should we be considering for trying one of these GLP agonists who might have chronic migraine or high frequency episodic migraine?
Well, the patients that we enrolled were patients with obesity. So, yes, the drug was not effective because of weight loss, but the population of interest was obese patients. So, we can speculate and we can think that maybe in the future we can extend the administration of the drugs also to other population. But right now, for the moment, the only evidence that we have so far is on obese patients. So, for the physician treating coming across a migraine patient who may be in this kind of demographic, what we think is that GLP-1 agonist may be an option, especially in complex or refractory cases.
Okay, so in complex or refractory patients who have high frequency episodic migraine or chronic migraine
Yeah.
and obesity, this might be an option to consider.
Yes.
Okay. Do you have any final thoughts to share?
Um, Not really, but no. I mean, what's most interesting to me about this study is that yes, of course, the headline, a new class of drugs may be effective in migraine. Wow, that's a massive, but also the possible implication. Again, the possible implication regarding the pathophysiology of migraine itself. It's especially interesting again to all of my group, starting with the Professor Roberto Simone, but all the group and to me as well. And we think that this could be a very promising avenue. It needs to be confirmed, but we think it's a promising avenue.
Wonderful. It's such a pleasure speaking with you. Thank you so much for your work. We look forward to more work from you and your group on this topic.
Thank you very much. Thank you.